Diabetes is a chronic condition that impacts more than 37 million Americans, with around 90% having type 2 diabetes. The pancreas isn't able to secrete enough insulin, a hormone that regulates the movement of sugar into cells. This is due to insulin resistance and insulin deficiency, resulting in hyperglycemia. Hyperglycemia leads to glucose toxicity. This is what causes pancreatic beta cell dysfunction that can cause serious health problems such as heart diseases, vision loss, and kidney disease. One is at risk for type 2 diabetes if you are overweight, have family with type 2, given birth to a baby weighing over 9 pounds, or if you have non-alcoholic fatty liver disease. Testing for type 2 diabetes includes a blood test, urine test, and more commonly a hemoglobin A1C test. Diabetes is monitored by hemoglobin A1C. On average, healthy HbA1c levels are less than 5.7%. However, in diabetic individuals it is greater than 6.5%. One of the main risks for diabetes is obesity, which doctors work to treat through dietary regulations and modified lifestyles by optimizing metabolic parameters such as blood pressure, lipid counts, and metabolic surgeries. With obesity comes the challenge of weight loss. Dietary and lifestyle changes don't always prove to be beneficial to all. However, in the past 15 years, new classes of diabetic medications have been made available for management of type 2 diabetes by targeting glucagon-like peptide 1, GLP-1, receptor agonists. Dipeptide L-peptidase 4, DDP4 inhibitors, and sodium glucose cotransporter 2 inhibitors, SGLT2. Despite the advancements in therapy, scientists have found the T2 German marks patients don't achieve optimal sugar levels. Therefore, they have searched for a drug that not only would treat the HbA1c but also cause weight loss. There was still hope though, because on May 13, 2022, a new drug was released to the public, Tirzaptide. With the help of Tirzaptide, weight loss is possible and helps manage hemoglobin A1c levels by reducing weight and lowering blood glucose levels. Tirzaptide, or as it's commonly known Mounjaro, is a dual receptor agonist of GIP found in the duodenum and jejunum and GLP-1 found in the distal ileum and colon. Tirzaptide was derived from GIP hormone, resulting in a 39 amino acid peptide. It is available in 6 doses: 2.5 milligrams, 5 milligrams, 7.5 milligrams, 10 milligrams, 12.5 milligrams, 15 milligrams, as a clear, colorless to slightly yellow solution. It is available in prefilled single-dose auto-injector pens for subcutaneous injection taken once a week, and travels into the intestinal tract where it interacts with the receptors, increasing lipolysis, lipogenesis, beta cell survival, cardioprotein, and decreasing bone reabsorption. Tirzaptide was developed by Eli Lilly and was approved by the FDA on May 13, 2022, after being in the human clinical trial phase starting June 8, 2019. In Phase 3 trials there were 5 clinical trials conducted, Surpass 1 through 5. During Surpass 1, Mounjaro was studied as a monotherapy. In Surpass 2, 3 and 4, the drug was studied as an add-on to common diabetic medications metformin, sulfonylureas, and SGLT2 inhibitors. In Surpass 5, it was evaluated in combination with basal insulin in, plus or minus, metformin. The doses were monitored at 5 milligrams, 10 milligrams, and 15 milligrams. The trials were conducted with 1 injection weekly with placebo. Surpass 1, semaglutide 1 milligram, Surpass 2, insulin degludec, Surpass 3, and insulin glargine, Surpass 4. These studies were then combined with basal insulin with or without metformin compared to placebo in TID patients in SURPASS-5 clinical trials. The results of the trial showed reductions of 1.8% and 2.1% in the blood glucose levels for patients who received 5 mg and between 1.7% and 2.4% for both 10 mg and 15 mg of Mounjaro. Scientists also saw a reduction in weight. Those who received 5 mg saw a weight loss of 12 pounds, while those who received 10 to 15 mg saw their weight reduced by 25 pounds. After administration, it takes 8 to 72 hours for patients to have maximum plasma concentration. The mean absolute bioavailability of the drug is 80%, and similar exposure was achieved with administration in the abdomen, thigh or upper arm. In a study that looking at Mounjaro plasma concentration of 39 patients, the Cmax of Tirzaptide was found to have a range of 0.25 mg to 15 mg based on the range of dosing per patient. Whereas the Tmax was evaluated after injection between 24 to 48 hours after injection. The elimination of Mounjaro is 0.028 L/h with a T1/2 of 5 days, enabling once-weekly 5 mg dosing. Mounjaro is metabolized by proteolytic cleavage of the peptide backbone, beta oxidation of the C20 fatty diacid moiety, and amide hydrolysis. Once the drug has run its course, it is excreted in the urine and feces. Intact Mounjaro isn't present in the excretion. Tirzaptide is a drug for type 2 diabetes mellitus and obesity. Through research into the biomarkers of blood glucose levels, plasma glucose levels, hemoglobin A1c, and weight. Tirzaptide was studied under other biological biomarkers, but either were not impacted or were not affected by the doses taken. But research shows that based on some dose of Tirzaptide, the triglyceride levels may be impacted in a positive manner. Mounjaro lowers fasting and postprandial glucose concentration at 15 mg. It reduces fasting glucagon concentration by 28% and glucagon AUC after a mixed meal by 43% compared with no change for placebo. After 28 weeks of treatment, it also works by delaying gastric emptying. The delay is largest after the first dose, and this effect diminishes over time. Tirzaptide slows post-meal glucose absorption, decreasing food intake, and reduces body weight in patients. This is due to an increase in insulin secretion. Some side effects include nausea, diarrhea, decreased appetite, indigestion, vomiting, constipation, and stomachache. Some of the additional risk include thyroid C-cell tumors. It was observed in rats that it caused carcinoma and adenoma in both sexes. At this point, it is unknown if this is feasible in humans. So it is recommended that people with familial history of medullary thyroid carcinoma should avoid Mounjaro. Pancreatitis is also possible in trials. 14 acute pancreatitis incidents were observed in 13 Tirzaptide-treated patients. However, it is now unclear if pancreatitis will develop when taking Mounjaro. It is recommended to not take Mounjaro with other drugs, as there are potential confounding factors that could lead to low blood sugar, gallbladder disease, kidney damage, and impacting birth control. Mounjaro is also fairly expensive, without insurance costing around $1,230, which makes it hard for patients to obtain. In addition, healthy people have started using Mounjaro as a weight loss drug, making there be a scarce amount available to patients that have type 2. More uses for tirzapatide other than diabetes and obesity. In addition to looking at development of other glucose-oriented treatment for type 2 diabetes mellitus, further studies need to be conducted to look at